I tested negative for cooties.
Actually, chances are you do have cooties. And by cooties, I mean you have contracted the Epstein-Barr virus.
Hi, I'm Cameron.
I'm Cameron.
I'm Daniel.
And we're here to talk to you about infectious mononucleosis, so buckle up.
We've been talking about mono, or mononucleosis. Its full name is infectious mononucleosis, and it is caused by the Epstein-Barr virus, abbreviated as EBV. It's also known as human herpes virus 4. Okay, real quick before we get into the details of mono, its structure and all that stuff, let's look at the brief history. There's 4 significant dates here. The first is in 1880. 2 German doctors discovered an illness, and they isolated certain signs and symptoms that always appeared the same, and they named this glandular fever. Then, 40 years later, Sprunt and Evans, 2 scientists, renamed it, for whatever reason, infectious mononucleosis. And that's where we get the name that we use today. Now, the thing with this is they didn't, however, tie the Epstein-Barr virus, which is the cause of infectious mononucleosis, to infectious mononucleosis just yet. So all they did was change the name. 44 years later, in 1964, the stars of the show, if you will, Epstein and Barr, they discovered a new virus, and they called this virus the Epstein-Barr virus. And I don't know the reason behind why they named it that, but they named it that. And again, there was no tie between infectious mononucleosis and the Epstein-Barr virus. Now what's funny is 4 years later, after Epstein and Barr discovered the Epstein-Barr virus, a technician in a lab who studied the Epstein-Barr virus went on vacation with his wife and family. On the vacation, he started to feel sick. He felt the signs and symptoms of mono. When he got home, he decided he would have it checked out. So he ran tests in his lab, because that's what he does, and found that the signs and symptoms that he was feeling were from and identified with infectious mononucleosis. And he found the Epstein-Barr virus active within him. And so that is how the Epstein-Barr virus was tied to infectious mononucleosis. So we can now link infectious mononucleosis with EBV, Epstein-Barr virus. Okay, let's jump into the structure. So let's build this virus. We're first going to notice, if we looked at this virus under a microscope, you'll notice a wall per se around it, and this is called the envelope. And some viruses don't have envelopes, but the Epstein-Barr virus does. The next thing you'll notice are glycoproteins lining the outside of the virus. Now these glycoproteins, they help in attachment, and they stick out just like this. And there's many, many of them. They help in attachment, and inside of the envelope, we have a capsid. And the capsid, I can't depict perfectly because it's icosahedral, which means that there are 20 sides to it. So here's our capsid, and inside of the capsid is the core, and the core is what houses the DNA. And the DNA can be stored differently in different viruses. But in this specific virus, in the Epstein-Barr virus, we're going to have it double-stranded in a toroidal shape, so in the shape of a donut. And the way it's going to work is the double-stranded DNA is going to wrap around this core in the shape of a donut. And that's the term for toroidal. So obviously that's kind of hard to do and imagine, but there's this donut and it's wrapped spirally around it, and that's all held inside of the capsid, which is inside of the envelope. The way you'll never find this Epstein-Barr virus in nature. It has never been found in a natural environment. You can only find it on humans. And there's this dispute and debate whether it's found on primates or not. But it's found in humans, and it's found in the B cells of salivary glands.
Because it's most commonly found in the salivary glands, it's no wonder that this is known as the kissing disease. Symptoms of infectious mononucleosis tend to manifest about 4 to 6 weeks after your first kiss. Actually, that's not true, but they do tend to manifest about 4 to 6 weeks after you come into contact with the Epstein-Barr virus. Symptoms include extreme fatigue, fever, sore throat, head and body aches, and while the signs of this infection include swollen lymph nodes in the neck and armpits, as well as the possibility of a swollen liver or spleen, and possibly both. Sometimes infectious mononucleosis will manifest with a rash. Not all of these symptoms are present at the same time, and you might not experience all of these symptoms, but these are definitely the possibilities. The enlarged spleen and swollen liver are less common symptoms, and for those who do experience these symptoms, the enlarged liver and spleen remains much longer than after the fatigue ends. Most people get better within 2 to 4 weeks, but sometimes it can take a little bit longer than this, and it has been recorded that the infection and symptoms have lasted for up to 6 months or longer in some patients. Epstein-Barr virus, as we've mentioned, is the most common cause of infectious mononucleosis, but other viruses can cause this disease as well. The second most common is the cytomegalovirus, or CMV. Other infections that cause this are toxoplasmosis, HIV, rubella, hepatitis A, B, or C, and the adenovirus. This virus is spread most commonly, as we mentioned, through bodily fluids, especially saliva. It has been suspected that it can travel through and be transmitted through blood. Also been found in rectal mucosal secretions and genital secretions. So this raises the possibility that it can be passed through sexual transmission, although there is still some debate on this. If you share your glass or your eating utensils with someone who is infected with the Epstein-Barr virus, you could easily contract infectious mononucleosis. So if you know someone has it, stay away, don't kiss them, don't drink after them, and don't eat after them, and you should be okay.
As Cameron spoke on how people can be asymptomatic carriers, this can cause prevention and treatment to be difficult. When children catch EBV, the symptoms are less severe than as a young adult. You will see similar symptoms to a cold or nothing at all, while as a young adult, they are more likely to experience symptoms of swelling of the lymph nodes, and their symptoms will last longer. For even older adults, around 40 or 50 and upward, the symptoms can be even longer and may even cause jaundice. I will go on to speak on how EBV in and of itself is not so deadly, but because of its attack on the B cells, which support the T cells in our immune systems, it can cause some opportunistic infections.
So how can you avoid infectious mononucleosis? Treatment of IM is usually only treatable with the same remedies as for a cold or sore throat. This is via the use of lozenges, cold liquids, anything to ease the pain as well as ease the swelling during the course of the infection. Plenty of rest and liquids will help.
and also in some cases a corticosteroid will be used. In Microbe Wiki, it states that, quote, with the advent of an HPV vaccine, hopes for the HBV vaccine, EBV vaccine are high, but so far have just led to disappointment. With over 90% of the world's population infected, it is essentially impossible to prevent. Theoretically, avoiding an infected person's saliva would prevent the infection, but it's usually too common during adolescence to avoid, unquote. Prevention is difficult with most of the world's population infected already. Therefore, encouraging the separate use of anything that enters the mouth, as Cameron said, such as cups, bottles, utensils, as well as whenever you're in the presence of someone with symptoms of IM. Avoiding biting nails, touching your face, kissing, sexual intercourse can help with prevention. Infectious mononucleosis is not in and of itself a deadly disease. However, it can cause issues for those who have a suppressed immune system. Though only 78 people have been killed by EBV, it can worsen some conditions, and in a study documented by National Center for Biotechnology Information, they found that there were, quote, 142,979 deaths, which make up about 1.8% of cancer deaths that formed or were worsened by EBV. Most of these were in the East Asia and were more common in males by about 2.6 to 1 of a ratio, end quote. If EBV undergoes lytic replication, it can cause oral hairy leukoplakia, which mostly occurs in patients who have their immune system suppressed and are thereby more easily infected. It is observed as a white lesion on the tongue in the epithelial cells. EBV can worsen or give way to other ailments, usually in the lymphatic system where the B cells that have become infected exist. Some of these are hairy leukoplakia, Burkitt's lymphoma, multiple sclerosis neurological, Hodgkin's lymphoma, as well as other diseases in the lymph nodes that have the symptoms of swelling. Further, at Virology Online, a study found that, quote, those with poor socioeconomic conditions can be at a higher risk. In developed countries, 2 peaks of infection are seen. The first in very young preschool children ages 1 to 6, and the second in adolescents and young adults ages 14 to 20, end quote. In a sad story told on Immune Deficiency Foundation, a story of a young boy named David who was born with a severe combined immune deficiency. In 1971, he needed a bone marrow transplant, which was the only method at the time, and there was no match. David lived inside of a bubble, so to speak, which was protective gear that he wore outside. He was courageous, and he was excited to find a life without this bubble. But unfortunately, in 1984, after receiving a bone marrow transplant, he died from lymphoma cancer that was a result of EBV virus. His family and science, quote, his family and science has stated that because of what was learned from David's gallant life and death, many children with SCID have since been diagnosed early, received bone marrow transplants, and now lead healthy lives. In the words of his mother, David was a great blessing to our family and to the world, end quote. So let's all be aware of the infectious mononucleosis, which is caused by the epstein-barr virus. As it can worsen some conditions in those with a suppressed immune system. Be hygienic and aware around those with suppressed immune systems. There are many who take medications or for other reasons have a suppressed immune system.
So maybe next time you hear a kid say someone has cooties, you should believe them. Thanks for watching.